Roman Garcia, and I'm a physical therapist. Today we're going to be showing volume 2. This is a further elaboration of what we call the hip biomechanical marker of a healthy hip. Now, what I'm going to show today is where exactly those motions occur with this particular biomechanical marker for the hips. As soon as I discovered that this particular motion gives you an idea of the structural integrity of the hip, my next question is where is this motion occurring in the hip lumbosacral region? Now, I'm going to show you exactly where this biomechanical marker, anatomical motion, is occurring today. That is the objective of volume 2, this particular video. So if you allow me, I'm going to come right over here to my model, and we're just going to go through the biomechanical marker quickly. But any of you that saw volume 1 has seen it and it was described in that video. But I'm just going to go through it real quickly. Now, the model is actually in a prone position. Now, we already know that a normal hip will show a particular motion pattern or biomechanical marker. I'm demonstrating it as we go. We can see that the right pelvis rises a little bit. Left pelvis stays relatively flat. Again, I'm just going through the markers, through the pattern of what a normal hip biomechanical marker would look like. Vertical orientation at the tibia. That's a healthy sign. Internal rotation, approximately 45 degrees. Again, my opinion, you don't need goniometric measurement for this. You can get a very good gauge just by estimating. All experienced physical therapists know what 90 degrees looks like. They know what 45 degrees look like. Now, as you can see, that there's a little bit of asymmetry here in this model, in this patient. You see that the right pelvis moves slightly higher than the left. Again, you don't want, I'll repeat myself, you do not want to push down on the sacrum. Let the sacrum do what it's naturally going to do, because function always follows structure. Now, as we see this, again, vertical orientation of the hip. Now, let me show you on an x-ray where this biomechanical marker, where the motion is occurring. And if you allow me, let's just go right over here and I'll show you. There's two films here. One is pre-biomechanical marker, post-biomechanical marker. Pre and post. Now, the interesting thing about this x-ray is on the individual that we use to demonstrate where the motion is occurring. By accident, we discovered that the individual has spinal bifida, which was, for our purposes, was actually anatomically, it was a great condition to have because of the increased range where the spinal bifida occurs. Now, let me demonstrate where this spinal bifida is. L5, you can see that the spinous processes never fused. You've got them right. This is your L5 lumbar vertebrae right here. This is pre, this is post. Now observe, in the pre-film, the spinous processes are actually making contact with each other. Now, when we expose the lumbosacral hip region to the biomechanical marker motion, look at what happened. The spinal bifida portion actually opened up. You can see it right here. This is L5. You can see the gap between the unfused spinous process. It's gapping. This was actually during the actual test. Pre, right here, you can see it's not gapping. Here, it's gapping. The actual pert, or the biomechanical marker motion, actually, the mechanical energy, the motion moved proximally up into the lower lumbar levels. Now, what that told us is that this pert or hip biomechanical marker doesn't only give you a gauge of what's going on in the hip, but also gives you a gauge of what's going on in the lower lumbar level, because that mechanical energy moved proximally up through the hip, through the sacroiliac joint, and straight up into the lumbar spine. Now, and as I will show you again on this model, there's significance to this mechanical energy moving up proximally up into the lumbar spine. What that told us is that the hip biomechanical marker is not exclusive only to the hip, but also to the lower lumbar spine. So this test is actually a gauge of not only the quality of the hip itself, but also the quality or the range of motion or the structural integrity of the lumbar spine. Again, we'll just go through it quickly one more time. This is before the area was exposed to the hip biomechanical marker motion, pre and then post. Again, you can see it very clearly. It is gapping. So there was obvious a contribution of the lumbar vertebrae to this motion. Now, let's go back to the model. Again, now, interesting. Now we go back to this model. Now, understanding that this hip biomechanical marker is not only a marker for the hip only, but also for the lumbosacral region. Now let's use what we just learned from how the mechanical energy travels up into the lumbosacral region and try to interpret the signs given by the body. Again, we do it with the left. Pelvis stays relatively flat. Do it with the right, and you can see that it rises a little bit. Now, an interesting phenomenon when evaluating patients, if it's possible and you can get to both sides because of the parallax phenomenon, if you allow me, I'm going to move over here. You should always test your patient from both sides of the bed, because having a different position relative to the patient, the hip or the joint that you're evaluating will give you a different perspective, a different relationship between the segment and the rest of the body. Again, you see that the right pelvis moves slightly higher. The left stays relatively flat. One more time. Now, what does this mean? Now, what this tells me is that most of the hip biomechanical markers were normal. So in this patient, the hip, if an x-ray were to be done, the hip would look completely normal. This is a healthy functioning hip. But the interesting thing is this asymmetry which we just saw right now between the right pelvis and the left pelvis. The right pelvis raised up, the left pelvis stays relatively flat. So what that tells us, understanding that this test actually exposes not only the hip, but the lower lumbar level and the SI joint to a mechanical energy, and actually creates motion in those joints. We know that if this patient were to come with signs or symptoms in the low back or radiating into the pelvis, we would gauge just from this test alone that most of the structural deficiencies would not be in the hip, but would be in the lumbosacral region, specifically on the right side. Now, if you allow me, I'm just going to come right over here one more time. And the interesting thing about this is what started out as, in my mind, in my clinical mind, as a hip, as a joint, as a test that was exclusive to the hip, now has become a test that's not only exclusive to the hip itself, but also to the lumbosacral region. Now, that is the interesting thing about having some kind of new insight or thinking about something in a different way. Sometimes one question leads to another, which leads to another, which leads to another. Now, as we progress on this in the learning lab with further video volumes, we'll be discussing all these interrelationships between different segments of the body. Every joint in the body has them. We in the clinic we call them biomechanical markers. As we go along, we'll be slowly showing all these biomechanical markers as they are exhibited in a normal joint, and then later on in a dysfunctional joint. Again, I want to thank you for seeing this video. We'll be producing other videos as we go along. My name is Roman Garcia, and this is the Learning Lab. Thank you very much.